Hello. Hi, Dr. Harvey. So nice to see you.
Good to see you.
Yeah, welcome. I'm so excited that you're here today. I've been waiting to have you on. So we're just going to, wait a little bit. People will be joining us soon. Welcome, everybody, whoever's on the call. So please write in and announce yourselves. Tell me who you are and where you're from. And I'd love to chat with you. We have a special guest today, and I'm going to introduce her in a little while as soon as people start coming on. So please let us know when you get on, and then we'll get started. It takes people a little while to get started and come on. So we'll even open it up, to questions at some point as well, if that's okay with you. So
sure. Yeah, that's great.
Yeah. I know this has been such a difficult time for everybody, and it's affecting everybody worldwide. I mean, it's not even just us, right?
Yeah, right.
It's so many ups and downs, and I know I've been going through my own little ups and downs. You hear things, and sometimes you feel okay, you get through the day, you're really busy, and then sometimes when you're with your own thoughts, then the enormity of the situation starts sort of hitting home. Yeah. So.
Yeah, it certainly is a challenge. It's a challenge for everyone.
Yeah.
No one is out of that loop. Yeah.
Yeah. Yes, indeed. And you have just opened up your new practice now, so you're seeing patients.
Yeah, it's exciting in the midst of a pandemic. So we're figuring it out. We're just working our way through the process, but it's a good thing. It's all good.
Yeah. It's
a good time.
Anytime you start that, right? Something new.
Yeah.
So you know what? Maybe I'm going to start with a grounding exercise. So here we have Carol. Hi, Carol. Welcome. She says, hi, Dr. Rao. Hi, Dr. Harvey. And the two of my favorite docs at the same place at the same time. Amazing, she says. Well, welcome, Carol. We're so glad you're on today. We are as excited and pumped up. Oh, we have another person here. Hi, Linda. How are you? Welcome. So Linda's on, and so okay. So why don't we have a special guest, as I said earlier. It's Dr. Amy Harvey O'Keeffe. I will introduce her fully in a little bit as soon as I finish our quick centering grounding exercise. And you guys are in for a treat today. Dr. Harvey is one of my favorite docs as well. I can add myself to that list, and a dear, dear friend. So I will be introducing her and telling you all about her. There's a lot to tell you about her. And then we'll get started. We have one more person here, Mary. Hi, Mary. Welcome. Glad to see you on. Okay, so let's do our quick centering, grounding, breathing exercise. So I invite you to please close your eyes and just take 3 deep breaths, please. Breathe in, inhale, and exhale slowly. Take another deep breath, please. And exhale slowly. One more deep breath. And exhale slowly. Visualize the cord that extends from the top of your head, connecting you to your higher power or God or the universe. Visualize this cord running through your body along your spine and extending down into the ground and connecting you to Mother Nature. Now visualize golden light pouring into every cell in your body, centering you and energizing you. Visualize holding hands as a group. Inhale deeply and exhale slowly. and send out love and acceptance to every member of our group on this call and all those who may be listening to the recording later. We have now created a supportive environment for all of us to learn from each other's questions and comments and experiences. We have also created a circle of love. So visualize this circle expanding from our group and sending that love out to people in our community, the neighborhoods, your city, our state, our country, and globally throughout the world. We have now created a healing circle for all of us to connect with each other. And take one more deep breath. And as you inhale, just visualize all that love coming back to you and helping you to stay centered. Breathe in and slowly exhale and be present right here, right now. And now you may open your eyes. Well, hello, everybody. Here we are, centered and grounded. We have a couple more people who have joined us. Hi, Sandy. Welcome. Glad to see you here. And hi, Cindy. Cindy is my assistant and friend. So she finally gets to meet Dr. Harvey. She's heard me speak so much about you over the years. And she says, I've heard many great things about her. I'm one of her fans. So I'd like to introduce Dr. Harvey formally to everybody here. And like I said earlier, you're in for a treat. So Dr. Amy Harvey O'Keeffe is board certified in obstetrics and gynecology and has been providing healthcare for women of all ages in the Mercer Bucks County region for almost 30 years. She has recently joined Capital Health OBGYN in Browns Mills, New Jersey, specializing in menopausal medicine and engaging women in their own health and wellness. Dr. Harvey O'Keeffe has been recognized by Philadelphia Magazine as the top doc in the greater Philadelphia area. She received her medical degree from Temple University School of Medicine in Philadelphia, PA, where she also completed her OBGYN residency. Dr. Harvey O'Keeffe speaks both locally and internationally, educating healthcare professionals and community members on women's health topics. In 2010, Dr. Harvey O'Keeffe established the Gynae Girls. Oh yes, I'm quite familiar with them, right? A monthly cancer support group for women diagnosed with gynecological cancers. Dr. Harvey O'Keeffe is known for her unique practice style that blends wellness, coaching, integrative medicine, and comprehensive women's healthcare. Her personalized approach to care encourages daily meditation and behavioral changes centered on achieving a healthy lifestyle. Welcome, welcome, Dr. Amy Harvey. It's so excited to be here with you and have you here with us. And so I'd like to get started with asking you, our topic for today is handling the uncertainty of reopening society, and that's so much on our minds today. So tell us a little bit of what do we know about this virus? I know we get this information from all sides and we don't quite know what's real and what's not. So maybe you can help us there.
Well, first of all, thank you for having me on tonight. It's just a pleasure to be here with you and to see all of the great participants in the chat. So thank you for having me. It's a pleasure. I feel strongly about educating people, no matter what. I think as a healthcare provider, it's one of our goals. And I think, when we talk about the coronavirus or COVID-19, as I'll just abbreviate it, there's a lot out there, and we know a lot about it in the medical community, and there's been a lot out in the news. So we don't need to know too many of the basics, but what we do know about the virus is it is a new virus. So we're learning about it, and we're kind of on that cutting edge. And that is part of what the uncertainty is for all of us, whether it's medical professionals, whether it's epidemiologists, the researchers and scientists. This is a brand new virus, and it's a challenge when you're learning on the fly. So we don't know how it acts. We don't know how to treat it. We don't know how to stop it. We don't know who's going to get infected. And that's what creates so much of the uncertainty. What we do know is, there are people who are at greater risk, and we're learning what those categories are. And it seems like every couple of weeks, we actually get some kind of flavor of something new that we learn about the virus. There's hints of it maybe when you look back, but we learn more. So, initially we thought it was more of the elderly population that got infected. Now we're hearing more about, the Kawasaki-like illness that we see in young children and teenagers. We realize that, there's a greater proportion of men who get the disease and who actually have a worse course with it. And that's something we learn. We now realize that people who have comorbidities or other health conditions, high blood pressure, obesity are two of the big ones that we see that put people at greater risk for having infections. So these are all, things that we're learning about it. But the evolution of what we know about this is we're right there with it. We don't have a book that we can open up and say we know about this virus and what can we do to treat it, or how can we impact behavior. So one of the important pieces that we have to remember is some of the new data coming out looks at how do we get the virus? And we know it's a respiratory virus. Mm-hmm. We know we get it through contact with our mouth. So the important pieces of, cover your mouth, cover your, now we know face coverings or face masks are important. Washing your hands, because we tend to touch things with our hands like doorknobs and whatnot. And then we infect ourselves by touching our face. So washing our hands, not touching our face. But the most important piece is staying isolated from someone who has it. And the problem is we just don't know who has it, because there's many people out there don't have any symptoms. We didn't know that at the beginning. We thought it was you had symptoms. And so now we know that there's quite a good number of people who are infected that have very mild disease or have no disease outwardly showing. And that's the challenge for all of us, I think, is finding out who they are. That's why when we look at, how do we sort of control the disease, what do we know how to control it is we lock everybody down. If they don't move, they can't give it to somebody. And then we have to trace people who have infections and go backwards and say, who were you in contact with in the last 3 to 5 days? Test those people, isolate those people until we know the answer of their, do they have it or do they not? So there's a lot that we know about the disease, but we still are learning. And that's the part that kind of makes this scary. As to, when the researchers and the scientists can't give us concrete answers, that's it's unsettling for all of us, I think.
Yeah. The scary part is that, we never expected young people. I'm not even saying kids, mm-hmm. but the 20-year-olds, the 25-year-olds, they're all fine, but they're not fine. I mean, those people are dying every day. Yeah. So anything we can speak to that, like why that population is getting it?
I don't think we know yet, but if you look back at the Spanish flu, the pandemic of 1918, there was a W-shaped curve with that pandemic, if I remember correctly, and that's we know from influenza that the young and the elderly are the two populations that get hit most in regards to diseases that attack us. And so originally we thought, well, maybe this is like influenza. It is not like influenza. It's quite different from influenza. It's different than the common cold. It's not something mild like that, like a cold can be. It really has a much worse, process. But there's that middle. The W is the middle group of the 25 to 30-year-olds, and we saw that with the Spanish flu, where a lot of young 20 to 30-year-olds were affected. Mm-hmm.
Actually, my grandfather died. He was a medical student. He was only 21 years old, or maybe 22, and he died of the plague in India in 1920. Mm-hmm, to what you just said with the W curve with these pandemics, you never know. The young, strong people are affected as well. So how can we find some level of certainty during this time when we're all feeling so vulnerable and we don't have answers in our physical health and in our emotional well-being? How can we find some level of certainty?
Well, I think, we start with what we know. We work from the place of the things that we are certain of, and we can control certain things. And the things we can't control, we have to let go of that. But we can control our behavior. We can control our actions. We can control our response to, do we sit around and watch the news 24/7? I think a lot of us did that early on, and we realized for the long haul, for our sanity, we can't do that. We need to take a break. We need to put that positivity back in. So, I say, finding a reference point of seeing the positive in things. One of the nice things that, I've noticed, I follow the trends. I don't look at them every day, but I follow the trends because I need to know how to counsel my patients, my family, my friends, and just to have some sense of what I need to do myself. So the trends are looking better. We do see numbers declining. We do see the infection rates appear to be going up because we're testing more. But the number that we need to really look at overall is the number of hospitalizations. That is the one piece as physicians we know won't change from external factors. If you're sick enough to go to the hospital and get admitted, that is sick. And that's a steady kind of a measure. You're not mixing apples and oranges. The number of positive tests, the number of people who die from the disease, there's many variables that get thrown into those two numbers. So you have to be careful in trying to compare those. But if you want to look for trends over time, the number of hospitalizations is the key. So, in finding our place of security, it's, what do we know? Things are looking better overall because what we're doing is working, not because there's magic. It's because we've all done our homework and stayed home and covered our mouths and are, trying to protect ourselves and our family and our community. And that's the place we need to be. What we can control is our actions.
So at what point do you recommend that we take our symptoms seriously to say, okay, this is not just a little, something going on. I need to contact my doctor and go into the hospital? Because you're hearing so many cases where people are waiting for whatever reasons or not going in. And when they go in, their blood level has dropped and, they're in really critical state. So at what point do we say, and at the same time, we don't want to overreact and rush every time to have a little, although I must say this morning when my husband woke up with a little cough and a little scratch in his throat, I was ready to jump up and call the doctor. But we don't want to overreact, and he's okay, by the way, so not to worry anyone. So at what point, because they say, oh, treat these symptoms and stay home and don't go,
Right.
Tell us what.
Well, the first thing is, I always say everyone should contact their physician and talk about their symptoms, because someone talking to you on the phone can get a little bit of a sense of what actually is going on. But the golden rule of, if you're short of breath, that is if you're having difficulty catching your breath and breathing, that's time to go to the hospital. But that's one I think has been out there, and we've talked about that over and over again. But there are enough even smaller clinics and urgent care that are now really doing evaluations, and you do want to talk to your physician, explain your symptoms. They can help guide you. They may say, they want to have you seen at one of the sick clinics that have been opening up in the areas, or they may want to actually see you themselves, or they may refer you to the emergency room. But it is best to, if you have any questions, to just pick up the phone and call your physician, or call the local health centers that are in your area that you can normally visit, because they can help guide you. I mean, but the shortness of breath is the key one. That is one that there's no way to evaluate you otherwise, other than seeing you in person.
Mm-hmm. Because I have a number of patients who have other, illnesses. Some may have, a lot of them have heart issues. including my husband does. So they are extremely on edge. So, that's why I was asking you that question, that people are on edge. They don't know whether they're going to get sick and at what point do you seek help. So,
right. Yeah, it's we worry because we all feel our own vulnerability in this. And I think, when we look at our society, we struggle with vulnerability, even not in a pandemic, but at all times. And I think that sense of vulnerability it's become very uncomfortable for us in our society to tolerate any level of uncertainty and vulnerability. We really taken to the path that's so uncomfortable. We don't want to sit with it. We want to either numb it, we want it to go away, we want to deny it. And I think this is a lesson for all of us, is that, life is very uncertain. So we have to hold on to the things we know that are certain, and we have to have faith. Again, another place of vulnerability, having faith, things we can't see, but have faith that, we will be guided, to get through what we need to, but to be smart about it, calling your doctor when you need to, paying attention to your symptoms. But vulnerability I think is a bigger issue that we were grappling with before this pandemic.
You really hit on such an important topic of vulnerability, because as human beings, I think we look for control, and control makes us feel safe and secure. So when we feel out of control with something, and uncertainty certainly makes us feel not in control. And that increases the level of anxiety, because I see the level of anxiety in my own patients has simply skyrocketed because of exactly what you said, that vulnerability. And it's hard. We're not trained to sit with it. We are trained to look for fixes, right?
Exactly. Yeah.
A quick fix.
Yeah, right. Or to, just to make it disappear. If I'm anxious, I'm nervous, I think Brene Brown has done amazing work on this. So if you look at her research, and it's right. If I could, we resort to numbing. We find our alcohol, we find our banana nut muffins, we find our, video games, whatever it is. And I think this is a lesson for all of us, that we, sitting with our vulnerability and accepting that as a part of life. Doesn't mean we have to, put ourselves, high on anxiety levels, but it's, there has to be some resilience to, learn some other tactics like, meditation, things that will help us, work through when we feel that, and really dig into why do we feel that, rather than trying to make it vanish into thin air, because it won't. It'll come back, as we know.
And when you sit with an emotion, I teach people something called the peace process. And when you sit with it, you can get through it, because that feeling starts to then dissipate. But the more you resist it, the higher, that anxiety increases. But if you just sit with it and accept it, it starts to kind of, it might move around in your body, but then it starts to dissipate. And, so I totally agree with you that we need to train ourselves to do that. It's hard to do, because you want it to be fun.
Oh, this is not easy work. None of us, you and I both understand we're all on that journey. That's not something you can just sort of, sprinkle pixie dust and it's all there. It's hard for all of us.
Yes, indeed. So why is testing so important to get back to a new normal? Like when we open up, we keep hearing about the testing. Can you tell us a little bit about why that's so critical, and what that,
Well, the first part is, our concern with our testing right now is, we have a couple things. One is we can test for the virus itself. These are RNA, DNA types of PCR tests, we call them, very scientific terms, but they're testing for the virus. That's to find out who has the disease. There are some newer tests that they're looking at that are being developed, but we're still quite a ways from having them come onto the market in a large way, and that's an antigen test. And that's like looking for little tiny fragments of the virus is a better way. And think of it as, can I do something like a pregnancy test right at a point of care, rather than sending it to a lab where it might take a day, 2 days, 5 days, however long it takes. But can I do something that might take a couple of hours, 20 minutes? Most of the antigen tests that we hear are really 3 to 4 hour tests. So they're they're not instantaneous like a pregnancy test, but they're kind of like that. They're, a much faster one. And so that will add to the mix when we have it. And then there's also the antibody testing. The antibody testing is a blood test. There's a couple of tests that are really being studied. There's many tests that are open on the market. And a lot of these tests have come about because of the Emergency Act that the government has allowed. The FDA has sort of given all of these tests sort of ability to be placed out there and be used. But the antibody test is one that looks for previous exposure. So that's to say, have you had COVID-19 in the past? The problem with all of these tests is we don't know enough about their level of accuracy. Is a test that's positive, is it really positive? Someone who's negative, is it really negative? So, the test for the virus has a 30 to 40% false negative rate. That means somebody who comes in looking like they have COVID, we test them and it's negative. They have a 30 to 40% chance that they actually really are positive, but we missed it. So that's a pretty high number, and we don't like that high of a number. But again, we're still learning a lot about these tests. They were thrown into the marketplace. We've scrambled to try to get them, to use them. So we're kind of backpedaling now. We're trying to get more research and science to back up which are the right tests. Are there ones that shouldn't be used? How reliable and predictable are these tests? And can we put some faith in it? We obviously have to put faith in something, and a test is a test. So we'll understand that there are limitations to them, but a positive test is a positive test. Could it be a false positive? Sure. But we're going to act on how we're going to treat that patient. But the reason testing is so important is in order to start to control the pandemic and get the virus under control, we have two ways of handling it. One is we lock down our society, and I mean lockdown. If you told everybody, stop where you are and don't move, go home, just sit there, 2 weeks, 3 weeks, 4 weeks. If we did that 100% across the board, well, first of all, that's not feasible. But if we did it, that would be one way we could control the virus. But we have people in hospitals and nursing homes, and we need food, and we need to get medical supplies transported across the country. So truckers and airplanes. I mean, we have to move. 50% of our population at least has to move as essential workers. So we can't lock down completely. So a partial lockdown doesn't take 2 or 3 weeks. It takes months. So that's one way. If you stop the movement, and we saw that in Wuhan, China, they locked that city down. Millions of people didn't let them leave at all. And that was a great undertaking. And it's hard to tell how much of the data we can trust coming out of some of that of these other countries, but it is what it is. They did a remarkable job on a lockdown. The only other option we have to control the pandemic is to do what we call contact tracing and then isolate. And that means somebody walks in and says, I don't feel well, and you test them and they're positive. You say, who have you been around in the last 3 to 5 days? And then you find out who they're around, you test them, you isolate them, and you control it in little clusters. And that is what we are going to need to do over the next 6, 12 months, and maybe even longer. I think this is going to take longer than what we really think, but it's probably going to be at least 6 months, if not a year or even more. So contact tracing and isolation have to be in place. And so once you start to let up on keeping people locked down and sheltering in homes, you have to have the alternative available. And that's what the health administrators and Dr. Fauci and all of the heads of our federal agencies are very worried about, because we don't have in place right now the thousands of people who can do contact tracing in our cities, in our towns, in the counties, and we don't have the ability to test millions of people every day. We're at 500,000 a day at most. Maybe over the past week, that's probably been the average, maybe at most. And we need to do probably 10, 20 million or more as a possibility, because we are going to start to see people coming up with more symptoms as we let loose, loosen up on the shelter in places and the lockdown. So testing is very, very important. We can't ignore it.
especially I think because there's so many protests going on in terms of, wanting the country to be opened up fast. But I think, to your point, until we have a good amount of testing and contact tracing, it's dangerous to open up because we're seeing cases going up in other parts of the world as well. So what behaviors can we adapt or modify to lower our risks moving into the months ahead, regardless of what is going on outside? Like they may say, okay, let's open up everything. But what is a personal responsibility that each one of us needs to take to be accountable to not only ourselves, but to other people, to keep all of us safe? So what can we do?
I say, let's look at what we did first. We restricted our movement. And if you don't need to move out and about, don't do it. Stay at home. Limit your trips out to the grocery store. Every time you step outdoors, you are potentially exposing yourself and exposing your family. And you're also potentially exposing other people if you are an asymptomatic carrier and you don't know you have it. So, it is important to go back to the basics. We've heard these for 8 weeks now. This is not new news. And the first things that we put in place are the last things that are going to disappear. Mm-hmm. So, we stayed at home. We covered our faces with, making sure we weren't coughing and sneezing on people. So we want to make sure that we're protecting the people around us. Now we're wearing face masks. I think face masks are extremely valuable because they remind us, first of all, not to touch our face, because that's the important part of, preventing infections from getting close to our face with our hands. Washing our hands, having alcohol, hand sanitizer if you can't wash with soap and water. But you go back to the basics. Those behaviors, those are the ones that will be in place for a very long time. And we've got to find a way to get through life and get back to a new normal doing them. And that means, as the society opens, you're not going to want to do as many things as you used to do outside of the house. You're going to want to make sure you have hand sanitizer. You want to have your face covering with you. So those are all the same, the same things that we've been doing all along. I found it interesting when we looked some of the new data coming out, looking at these infections, and we know that the risk for infections is not just being in the vicinity of someone who has the virus. It is how many virus particles are you getting in contact with, and how long of a time are you exposed to it. So we know face-to-face contact for more than 10 minutes is one of the higher risk. So we say, trying to limit any contact face-to-face for less than 10 minutes. And we know being in closed spaces, places that have less air circulation, more people in smaller places is the risk. So, you want to avoid, groups of greater than 10. I wouldn't even venture into groups that big, certainly. But the high risk places that we can avoid, I will say public bathrooms, we're now finding have the potential to produce a lot of aerosolized particles because of when you flush the commodes. So there's also a lot of places that you can touch in a bathroom. So those are risky places. Places where there's shouting, there's singing, like choir practices. There's a lot of that sort of coughing, sneezing, anything that's going on where your particles are coming out. Avoiding those types of activities, which is why we wear face masks now, to protect other people from our own particles. So, yeah.
So, Dr. Harvey, there's a question that has been put in the chat box, which relates to what you just said about testing. So it says the 30 to 40% of false negatives is concerning. How would you advise someone who tested negative that's been around multiple confirmed cases? This is from Dora. Thank you, Dora, for your question.
It's a good question, Dora. My recommendation is if you've been around confirmed cases, you want to isolate. You want to keep yourself away from other people because you may actually be infected. Positive test, negative test, never having had a test, you're at risk. What you do want is if a negative test, if you're not having symptoms, probably no need to be retested, but certainly you want to continue the isolation because that doesn't mean that you're not infectious. I do think that antibody testing down the road is going to be helpful for a lot of us who thought we had contact with COVID came up with a negative test. I think we're going to see more antibody testing in patients who are, or people who are like that scenario. But you still need to, if you've been in contact with someone, the rule is you want to isolate yourself because you're a potential risk.
Thank you, Dr. Harvey. So how do we tend to our general health during a global pandemic like this? I know we are all clued into and focused on, the COVID-19, but there's so many other things going on. So how do we keep our immune system boosted and keep ourselves healthy?
Well, that's, the important things of eating healthy. Most of us are trying to eat healthy, but, we're falling off because we're all stress eating and comfort eating. But, eating healthy, staying active, go back again to the basics, but we have to, and I've said this all along, the healthcare community has to figure out how to get people back to healthcare for non-emergent and more routine care. Yeah. We know, the scary part of all of this is when the pandemic started in the first several weeks, there was a huge drop in the number of heart attacks and strokes that were going into the emergency rooms. And they said either these people are at home and they're not coming in out of fear, or they're under our noses in the hospital because they are COVID patients and they're not able to complain of chest pain or whatever because they're laying in a hospital bed, maybe even on a ventilator. So, we have to keep in mind that, illnesses happen, appendicitis happens, gallbladder attacks happen, everything continues on. Skin cancers happen, breast cancers happen, and we don't want to lose track of that. We have to find a safe way to do it. And as, a healthcare provider, we're looking for ways to bring patients into offices, doing it safely, limiting the time in any kind of waiting room, getting them into exam rooms, limiting the time face-to-face. A lot of telemedicine has really ramped up across this country, and it's great. A lot of the insurance companies have reduced copays, no copays for patients who are having telemedicine. As an obstetrician gynecologist, there's a lot of things that we can do that are on telemedicine. We can write scripts and we can do follow-ups for certain things. But there's a time we do need to get back to making sure we're caring for one another. So, we're learning how to do it safely. We're, opening our doors. We're taking it slow. Everybody wears a mask in our office. It is, it's a protection. We are doing some temperature checks. There's a lot of debate whether temperature checks, what are they really helpful? But, at this point they're in place. But, we want to make sure that we don't neglect our general health and that we make sure that we're, thinking about how can I safely get to my family doctor, get to my, gynecologist, get to my cardiologist. We need to continue doing that. And this is the time to think about it.
So you would also encourage people for their routine other tests as well, right? Like mammograms and pap smears and echocardiograms for my heart patients and, all those. Because people are putting all that up as well. The routine testing,
Yes, for 3 or 4 months, you push things off and now you have delays, and that could potentially mean a delay of diagnosis for things that you don't want to delay. Mammograms are tough because as most of us who have mammograms, we know that, you're very close. You're face to face with the mammography tech who's helping get your mammogram done. And so they are figuring out, they saved first, the people who really needed to be done. And now most of the mammogram units in our area are slowly opening to schedule for routine mammograms over the next, 4 to 6 weeks. But so we don't want to lose track of just maintaining our good health because, that's extremely important. We're going to get through this. We're going to get through the pandemic. It will maybe be around for a very long time. It may be around forever. This may be a virus we never get rid of. We don't know. But so we have to find that new normal. We found a new normal after many illnesses. We found a new normal after 9/11. We're going to find a new normal, and we have to have faith that that's going to happen. And we have to prepare ourselves to stay healthy until then too.
Yeah. So what are some daily practices that you might recommend that we could use to really survive this pandemic and keep ourselves healthy? Is there some specific things you recommend?
I love this question. Thank you. First, I think the hardest part for us, I'm a firm believer that our purpose in life is for connection, and we make connections is why we are here. That's my belief. And it goes against every grain in our being to disconnect from one another. And I have said, we need to socially distance, but we need to emotionally stay connected with one another. It's a physical distancing, not an emotional distancing. And so anything that we can do to remain connected to our loved ones, to our communities, our places of worship, our places of work, it's so vitally important. That is what keeps us going. So, it's staying connected. It's having phone calls. We have little Zoom, luncheons and breakfasts with girlfriends. Family meetings can be done. Skype, there's FaceTime. There's so many options. So the connecting part, I think we need to sort of put high in because we feel so disconnected and isolated, and we want to make sure we balance the safety of our health with our mental health. I'm a firm believer in meditation. I think gratitude is the one thing that when you get into that place of I don't know how to dig myself out, I'm in that dark place, gratitude practices are for me, and I think many people would agree, are what keep us grounded. It's practicing gratitude. It's not saying it, it's practicing it. Sending letters, writing your little 3 things that you're grateful for. I do it sometimes in my phone, sometimes on a piece of paper, but every day I think, some days look very much like the previous day, but that's okay. But it's and finding that joy. I mean, there's still joy all the way around us. Every night when I watch the news or I read something, I'm looking for the positive side of what's going on. And you mentioned it before about the protests, and the people who are protesting, they're scared. There's financial. There's all sorts of burdens and fears that they have, and rightfully so. So we can't just discount the protesters. And I wish they protest with a mask on and maybe not be as close to one another, but it is what it is. But, having space for the fact that there's a lot of people that hunkering down in their houses right now, and they're not going out. Even as their society and their states are opening up, they're staying home. And they're staying home because they don't think it's time to open up. They're not ready to go out. And that speaks volumes because they're learning to, they're caring for themselves. But there's so much positivity that goes along with that. Between college kids hooking up farmers to, food banks and getting the food where it needs to be, to, just wonderful messages of what's going on with, in nursing facilities where, families can't get to their loved ones, but they're looking, talking through the windows. And there's a lot of positivity out there. There's a lot more than what we hear on the news. And that's the place that I would focus.
Mm-hmm. And also, I think, in this pandemic, it has given us all an opportunity, if we look for it, to really figure out who am I, almost like an existential question, and what are my values? And when you get in touch with those values, because otherwise we're rushing from, post to pillar, there's no time to sit and reflect. And if we can just use this time to reflect and say, what am I about? Or what is life about? What are relationships about? And you talked about connection. And I think this is a huge opportunity for all of us in the midst of this terrible time to see the good that's come out of it. Because all of us have, we're rising to the occasion. People are stepping up to the plate, right? So I think it's an opportunity to really look for that positive in the darkness.
Yeah, I say this is a time about the we, not the me. Yeah. And this is the time where my actions aren't about me. My actions protect you. My actions protect those who are around me. And, they protect me, but my goal in my social contract that I have being a member of our society is I can't make it all about me. I have to make it about who's standing next to me at the grocery store, who who do I see at the gas station pumping my gas for me?
Yeah.
I have to honor and respect and take it on as I need to protect them. That's why I wear my mask, but it's about the we, not the me. And, that's a hard lesson. Some people are trying to figure it out, but I think that's got to be the message. We got to take care of one another. That's how we get through a global pandemic.
Mm-hmm. Absolutely. Well, this was really great. So would you be open to a few questions if anybody had questions as we keep talking? So anyone who has any questions, this is your opportunity to ask Dr. Harvey, to help us out at this time. So why is this? So I'm going to just, we can just keep talking and ask you questions while other people sort of write in. So why is disconnection, this emotional disconnection, so challenging for us? Because I've had people say that, after a while, oh, we're sick and tired of the, the Zoom meetings and the other things. And so how, what else can we do? So can you speak to that a little bit more about that?
Well, it's, our purpose and again, I say this, my purpose, and I think it is, it's to be connected. It's to, form, bonds with others and of love and, have a positive impact on other people and make this a better place for each of us. But, when you disconnect, you lose that huge support that gets you through the challenging times. And, when I go through a challenging time, I pick up the phone and call my girlfriends. I call, my family members. And when you can't sit face to face with the person that you normally sit face to face to, it's hard, and it's easier when you can do it in person. But you have to make do with what you have. And if right now what we have is, a Zoom or a FaceTime or even just a phone call, you have to say that's what I'm gonna go with that, because that's what I got. But I think it helps hold us in and allows us to endure the hard times in life. It allows us to have that resilience when things get challenging. And so, and we got to get creative in how we can do it. Whether it's sitting out in the yard 12 feet apart on lawn chairs, thank God the warm weather's coming. I'm excited because that means maybe we can get a little bit true FaceTime with our friends. But, again, it outside in the open air is much safer than being inside a building. It's interesting, and we didn't talk about this, but, when we look at the data coming out of risk behaviors, and we talk about going to the grocery store. Going to the grocery store for most of us is actually very low risk, because we walk in, we are covered now with our face masks. We shop very expeditiously. We don't dawdle and sit there and check this out. There's not a lot of choices in many things anyway. And we get out of there. We're in the store 10 minutes, 20 minutes, max 30, 40 minutes, and we're gone. The problem is the grocery store workers. They come in, they're there 8 to 12 hours. The air is not circulating. It's a big building, but they're in, a big building with no air circulating. They have lots of people. They have lots of us hanging around them. They're a much greater risk. So, when we think about behaviors, think about how we impact the grocery store workers. I mean, that's something, we have to really think about how we impact other people's, lives and their health too.
Yeah, that's such a great point. Really a great point with the grocery store workers and others that we put at risk, because like you said, we, go in and leave, but they have to work there, all day long. So thank you for bringing that up. Yeah. So Mary has a question for you. How do we help older teens see a future beyond COVID?
Oh, it's tough. The older teens, especially, some of them have really been, shorted. They lost their proms, they lost their graduation. There's so much uncertainty. But I always said, no one ever told me when I was growing up that this was going to be easy. And this is the life lesson of, you get thrown a curveball. How do you make the best of the situation? you figure out a forge your path forward. We will get beyond this. We know history has shown we will move beyond this. That's a given. How it looks, that's what we need to start to work towards, making it look, healthy and safe. So, understanding that we have resilience, we can do tough things. Tough things help us grow, push our boundaries, make us think. This is a time, I say, think about the creativity that we get from having been forced into a pandemic. There are, platforms that we're, using to educate that we hadn't been really doing with our, the students in classes. Look at, the technology and how that's advanced. Look at how we're going to rethink, how do we shop? Online shopping. The whole world is turned to online shopping. So, I say we have to, again, go back to the positives. What have we learned from this, and how can we make the world a better place moving forward so we can adapt when things like this happen in the future, if they happen again. We have to make it a life lesson.
Yeah.
I hope that helps. It's tough. Teenagers, it's tough.
It is. Thank you, Dr. Harvey. Thank you, Mary, for your question. We have another one from Carol. She says, what is the relationship between blood pressure medication and how the virus affects the body?
I'm not quite sure that we know the relationship. We know that people with high blood pressure seem to be at significant risk for complications with COVID, but we don't really know how that is and what it is in regards to the blood pressure medicines in particular. We know that any condition that affects the cardiovascular system and the pulmonary system is a baseline. If you get COVID, you have a greater risk of having some complication or having a worse course. Again, I want to go back and focus. So Carol, the answer is, I don't think we know the answer to that. But focus on 80% of the people, at least at this point, we believe, have either no symptoms or mild enough symptoms that they don't go to the hospital. 80%. And so for most of us who get the infection, it's a mild course or is not one that's going to make us go to the hospital. And that's the positive side. It's being careful that, are we in the 20% or the other group that needs to be evaluated? But, health factors are a component that really you need to keep an eye on. Obviously it's just another reason that says we got to get healthy. We got to, maintain a healthy weight, maintain our blood pressure, all the things that we know that we should be doing. It just is an affirmation of it again.
Thank you, Dr. Harvey, and thank you, Carol, for that very good question. So, Dr. Harvey, we're getting so much information from all sides. So how do we trust the information that we're getting, and who do we trust? There are scientists saying certain things, there are other people saying other things. Newspaper reports are contradicting each other. How that's causing a lot of anxiety. So do you have?
Well, this is one that everybody has to figure out who can they plant their faith in that has a motivation to look after us. And I think the scientists are very driven to get answers. It's a scientific process. We study, we make hypotheses, we investigate. So I come from a scientific background. I'm a biologist at heart. That's what my degree was in. And I loved science for the sheer fact that you could study it and it was predictable. And, my general sense is I trust the scientists. Not all scientists obviously are gonna, some scientists may have other goals in mind and they may have other agendas, but for the most part, the scientific community is really pushing to help us understand this disease, to help us understand what we can do to protect ourselves from it. So I love Dr. Fauci. I think, America has latched on and thought Dr. Fauci has done a good job, and he has I think he speaks honestly. I think he's trying to spread the truth, but do it in as positive a way as possible without giving false hope, but allowing room for hope. And I think he's done a decent job. He's in a tough position, I think. And I think for most of it, I think our leadership has really tried to keep us straight. I think the governors in our local states have done a fantastic job, and the local health departments and our medical county directors and whatnot. I think they're really in it for keeping the community safe. So I think, we have to plant our faith somewhere, and my faith is in the medical community, the scientific community. I think kudos to them.
I totally agree with you. Dr. Fauci is, I think, my people as well, and that's who I listen to. To get the right information that we need to follow. So, are there any other questions? So it looks like we don't have any other questions, but I really want to thank you, Dr. Harvey, for this wonderful, wonderful session with us. And what I'd like to do is, if you don't mind staying on for just a couple minutes, I'd like to thank all the frontline workers, Dr. Harvey included, as well as all the ER physicians, the nurses, the other docs, all different kinds of docs who are putting their lives on the line for us. The hospital workers, the technicians, the cleaners, the janitors, the mail carriers, the trash collectors, the EMTs, the ambulance people, the street cleaners, who else? I would say law enforcement, security guards, grocery store workers, as Dr. Harvey already spoke about. Thank you, thank you, thank you. And I'd like to just please join me, everyone, in just saying this huge thank you to all the frontline workers, the essential workers, for putting their lives on the line so that you and I can stay safe and, stay home and have the privilege. It's a privilege for us to be able to stay at home. And also our sincere condolences, please join me, for all the people who have lost loved ones, and including my dear friend Marie, who lost her mother to COVID just, a couple of weeks ago in a nursing home. So it's very close to my heart as well. So I, let their souls rest in peace, and my, condolences to all these people, and let them have the strength to cope with these, terrific challenges that we're all going through. So, so thank you all so much for being here with us. And if there's any last minute questions, you can ask. So if you guys want to stay on for just like 3 to 5 minutes, if you wish, I'm going to do a little breathing meditation just to sort of close off today. And Dr. Harvey, thank you again. I will understand if, I'm sure you have other things to do. If you'd like to leave, that's perfectly fine. Thank you again. If you'd like to stay, you're very welcome. Okay.
Thank you for having me. Thank you very much for having me. It's been a treat. Thank you.
Oh, it's been a treat for us. And see, people are saying thank you, Dr. Harvey, and everybody's been thanking you, and thanks to all the healthcare and frontline workers. People are saying, Sandy's saying that, and Dora says thank you. So everybody is thanking you for being here and taking time out at the end of a busy day of seeing patients. I really, really appreciate it so much. You're awesome. Thank you again, my friend. Thank you.
Thank you, my friend, too.
Okay, so I'm going to do a really quick, it's 5 minutes or maybe 6 minutes, a breathing meditation just to close off this wonderful session with Dr. Harvey and just to send everybody in a nice place. So I invite you all to please close your eyes and find a relaxed, comfortable position. If you're seated on a chair or on the floor or on a cushion, keep your back upright, but not too tight. Hands resting wherever they're comfortable. Tongue on the roof of your mouth or wherever it's comfortable. And you can notice your body from the inside. noticing the shape of your body, the weight, the touch, and let yourself relax and become curious about your body seated here, the sensations of your body, the touch, the connection with the floor, the chair. Relax any areas of tightness or tension and just breathe, soften, and now begin to tune into your breath in your body, feeling the natural flow of breath. Don't need to do anything to your breath. Not long, not short, just natural. And notice where you feel your breath in your body. It might be in your abdomen. It might be in your chest or throat or in your nostrils. See if you can feel the sensations of breath, one breath at a time. See if you can feel the sensations again of breath, one breath at a time. When one breath ends, the next breath begins. Now, as you do this, you might notice that your mind might start to wander. You might start thinking about other things. If this happens, it's okay. This is not a problem. It's very natural. Just notice that your mind has wandered, and you can label it and say, thinking or wandering in your head softly. And then gently redirect your attention right back to the breathing. So we'll stay with this for some time in silence. Just a short time, noticing our breath. From time to time, getting lost in thought and returning to our breath. See if you can be really kind to yourself in the process. Just breathing in and breathing out, showing love and kindness to yourself. And once again, you can notice your body, your whole body, seated here or lying down. Let yourself relax even more deeply and offer yourself some appreciation for doing this practice today, whatever that means to you. Finding a sense of ease and well-being for yourself and this day. Now, take 3 deep breaths, please. Inhale deeply and slowly exhale. Once again, inhale deeply and exhale slowly. And one more time, breathe in deeply. And exhale slowly. Now you may slowly open your eyes, just feeling calm and relaxed. Again, thank you all. I hope that helped to just, center us. You can have a good night's sleep, hopefully. So thank you all so much for being here. And again, thank you, Dr. Harvey O'Keeffe. I really appreciate you so much. All the best to you. Stay well, stay healthy, and all our gratitude goes out to you for all that you're doing every single day, reaching out to your patients and everybody.
Thank you.
Thank you.
I appreciate it. Namaste.
Namaste.
Thanks.
Bye-bye.